A very common question asked to me by my patient is fat grafting permanent? And what can be expected for fat grafting? Now, fat, though being your own substance, though all of us want it to be a permanent, but the fact is some amount of fat is always lost. This is nothing but fat absorption. So fat is a living tissue, right? So when we take from one place and try to graft in the another, some amount of fat cells will always die. Now, these fat cells, when they die, multiple things can happen to them. One, they just get absorbed in our body. Our blood just absorbs it. So well and good, there's no harm done. But sometimes the dead fat cell can form something called cyst. That means they remain like a liquid within the area grafted. This is typically seen in larger fat grafted areas like the breast or the gluteal area. Or instead of the cyst, they can become hard. That means the fat can become calcified, forming a lump. Now, if it is a cyst or a lump, sometimes if it is too much, we may have to remove them. So whatever fat is being grafted, 100% never survives. So 30 to 35% gets absorbed. And this absorption, other than that, sometimes can go for calcification and cyst formation. So though fat grafting is permanent, but entire fat never remains. At the end of 4 months, whatever fat remains is what will remain with you for your life. Another point very important here to understand is this fat will act like the rest of your fat. In the sense, whatever fat we have grafted, if you're going to put on drastic weight, even this fat will become bigger. But if you're going to lose weight, you have a drastic weight loss due to whatever reason, even this fat is lost. So it will act like the rest of your body. If you want to maintain that fat, then you have to maintain your weight. If you're going to put on the weight, this fat becomes hypertrophy. If you're going to lose, even this fat is going to get atrophy. So if you have any more doubts about fat grafting, you can always message us.